365. Myself Srija. So today in this session you are going to learn about the isolate and CM coding classification from the series L50 to L99. So these codes, they include the skin conditions that involve the inflammatory reactions related to skin and subcutaneous tissue. So coming to L50 to L54 series. So what codes they include about urticaria and erythema. So this codes involve the inflammatory reactions such as hives. Hives are the raised itchy bumps, redness of the skin like erythema, sunburn, and radiation-related skin damage. So these conditions they generally occur due to the allergic reactions, intense sun exposure, infections, or the immune system responses. So what is L50? It is hives. So how do you define the urticaria? It's a sudden eruption of itchy raised wells on the skin. So this may appear anywhere on the body. Usually these are the short lasting but can recur. So what are the trigger points? Allergies, that is food, medicines, insect bites, heat, cold, stress, and infections. So what code L50.0 is the subcode for the allergic urticaria. So whenever allergic urticaria is diagnosed within the patient record, you have to assign the code L50.0. So this occurs specifically due to the allergens such as nuts, eggs, milk, drug, etc. So what is the clinical clue? You can see the symptom like intense itching plus raised red patches. So next code is about L52. So L52 is erythema nodosum. So what is erythema nodosum? It is nothing but it's a presence of painful red nodules usually on the shins, nothing but about the lower legs. So this is caused by the inflammation of subcutaneous fat tissue. So this can be linked with infections, for example, streptococcus throat, inflammatory diseases, pregnancy, and medications. So what is the clinical clue? It's a painful lumps under the skin rather than the surface rash. So L53 code, it's about other erythematous conditions. So this code is used whenever for the skin redness and inflammation that does not fit into the other specific categories. For example, like generalized skin redness, rash due to immune reaction or environmental triggers. So this is about L50, L52 and L53 codes. So next classification is from L55 to L59. So these are the radiation related disorders. So L55, it is about sunburn. So how do you define sunburn? It's a painful skin inflammation due to excessive UV exposure from the sunlight or the artificial tanning. So here the skin may appear red, warm, swollen and tender. So how do you code this sunburn? It is based upon the degrees, whether it is a first degree, second degree or third degree. So L55.0 code, it is assigned for first degree sunburn. Nothing but it only affects the top layer of the skin, that is epidermis. So there are no blisters, but you can identify the pain and redness. For example, spending long hours on the beach without sunscreen. So the left side, you can see a picture which shows how an allergic reaction leads to hives on the skin. So left side, it is a normal skin, right? So here the skin surface is smooth and not inflamed. So blood capillaries are the normal, no leakage, no redness or itching. Whereas right side, when the body is exposed to allergens such as food, drugs, insect bites, pollens, dust or chemicals, so the immune system, it reacts abnormally. So this is a difference in between the normal skin and the hive skin. So once the allergen effect reduces or antihistamines are given, so histamine release stops, capillary leakage decreases, swelling and itching fade, and skin returns to normal. So what is the main point over here? Urticaria is not an infection. It is an allergic reaction. So next coming to L57 code. It is skin changes due to chronic sun exposure. So whenever skin is exposed to long-term sunlight, so it damages the skin. So this includes the actinic keratosis disorder. So in these cases, you have to assign L57 isolate and CM code. So next coming to L58, radiation dermatitis. So what is radiation dermatitis? So skin injury is caused by the medical radiation therapy. So whenever during cancer treatments you undergo the medical radiation therapy, you undergo many chemotherapies, right? So whenever skin is exposed to the radioactive chemicals or radioactive metals, so you experience this radiation dermatitis. So whenever radiation dermatitis is diagnosed, you have to assign the code L58. So next classification is L60 to L75, which describes about the disorders of skin appendages, that is hair and nails. So the skin appendages, they include hair, nails, associated glands, that is sebaceous and sweat glands. So these diseases involving these structures are coded under the ICD-10 category L60 to L75. So what is L57? It is skin changes due to chronic sun exposure. So this leads to, I already said you, this leads to the cumulative UV damage. So coming to L60, nail disorder. So these codes, they identify the medical conditions of the nails. For example, L60.0, the ingrown nail. So what is ingrown nail? It's a side of the nail grows into surrounding skin. So this is called as ingrown nail. So this is most common on the toenails. How do you feel it? Like what are the symptoms? Pain, redness, swelling, and sometimes infection or pus. So the right side you can see the picture of ingrown toenail. This is a normal toenail. Nail goes straight without irritating nearby skin. Whereas ingrown toenail, nail edges start to penetrate the skin, causing pain and inflammation. And the third picture is about ingrown toenail with pus. So infection develops due to the bacteria entering the irritated skin. So why this happens? Because improper nail trimming, like too short or curved, tight footwear, too injury, and also sometimes it is related to the hereditary curved toenail structure. So this is about the L60.0, which is assigned for ingrown nail. So next coming to L60.1, which is oncolysis. So this slide, it explains about the ICD-10 codes related to hair and nail disorders, so which are part of the integumentary system. So L60, it is for nail disorders. For example, L60.1, it is about oncolysis. So what do you mean by oncolysis? It means it's a separation of the nail from the nail bed. So the nail becomes partially detached and looks white or yellowish in color. So this causes, they can include trauma, fungal infection, psoriasis, or the repeated irritation. So next coming to code L63, alopecia areata. So what do you mean by alopecia areata? It's an autoimmune disease, autoimmune disorder where the immune system mistakenly attacks the hair follicles. So it results in the sudden patchy hair loss on the scalp or body. For example, L63.0, alopecia totalis. So this is a complete loss of hair on the scalp. So it is a severe form of alopecia areata. It causes a complete loss of hair on the scalp. Whereas L64, androgenic alopecia, this is also called as a pattern baldness. So this is caused by a combination of the hormones and genetics. So hair becomes thin from hairline and crown over the time. Here you can see a picture. This is about the alopecia areata picture. It attacks the hair follicles. So whereas it's grade 1, grade 2, grade 3, these are the male pattern baldness. So this is common in male. It's showing the progressive thinning at the hairline and top of the scalp called as crown. So this grade 1, it is mild thinning, grade 2 moderate thinning, and grade 3 severe thinning with the visible scalp. So next coming to code L65, non-scaling hair loss. So what do you mean by non-scaling hair loss? It's a type of hair loss where the follicle is not permanently damaged. So hair has the potential to grow back, and examples, they include the telogen effluvium, stress associated hair fall. So next coming to L66 code. So this slide, it describes the several ICD-10 codes from L65 to L81. So these are mainly focusing on acne, cyst, folliculitis, sweat gland disorders, and pigmentation issues. So what is L65.9? It's a hair loss unspecified. So this is a general code used whenever the type or cause of the hair loss is not documented. So this is used when the medical record only states the hair loss without further details. So next coming to L66 code, it is a scarring alopecia. So what do you mean by Scarring alopecia, it's a permanent hair loss causing by scarring. So hair follicles, they are destroyed and they are replaced by the scar tissue. Nothing but hair cannot regrow. So what are the causes of scarring alopecia? Infections, autoimmune disorders, burns and trauma. So what about L70 code? It is assigned for acne. So what is acne? How do you define acne? It's a chronic inflammatory disorder involving the hair follicle and the sebaceous oil glands. So how it is triggered? By excess sebum, keratin blocking pores and bacteria and also the hormones. So there are two subcodes. L70.0, this is for acne vulgaris. So this is the common teenage or adult acne, whereas L70.5 acne excoriae, this is a skin lesion caused by excessive picking or scratching. In the right side, you can see the pathogenesis of acne vulgaris. So it's a healthy follicle over here. You will see the normal oil flow and then closed comedon, which is a wide head, that is sebum trapped under the skin, and then open comedon, it's a black head, and then inflammatory papule or pustule. It develops into the inflamed pus inside. So finally it forms into the nodular cyst, which is deep painful swelling under the skin. This is how the pathogenesis of acne vulgaris happens. So next is about cyst. So L72 code is assigned for cyst. What is cyst? It's a closed sac-like structure under the skin which is filled with keratin and sebum. For example, what is the subcode? L72.0, which is assigned for epidermoid cyst. So epidermoid cyst is also called as the sebaceous cyst. It's the most common type of the cyst. So this is the rounded mass inside the skin. Here in this picture, you can find the capsule around the cyst and you can find the sebaceous debris which is accumulated inside. So this is a picture of the epidermoid cyst. So you have to assign the code L72.0 for epidermoid cyst. So next coming to L73 code. This is assigned for folliculitis. So what do you mean by folliculitis? It's an inflammation or infection of the hair follicles. So how does it appear? Right, red bumps, pustules, itching, and sometimes even you can experience the pain. So L73.9 is the subcode folliculitis unspecified. So whenever folliculitis is documented but it is unspecified about the stage or site, you have to assign the code L73.9 for unspecified category. So next coming to L74 category, it is about the sweat gland disorder. So these are the conditions which are affecting the eccrine sweat glands. So this is caused by the blockage of sweat ducts in the hot humid environment. So these are the tiny red itchy bumps which leads to burning or prickling sensation. So for example, Miliaria rubra. Miliaria rubra. This is a prickly heat and it experiences a prickling sensation, right? So this is caused by the blockage of sweat ducts in the hot and humid environment. So coming to the classification of L80 to L99. This is the other skin disorders. So this section, they include various dermatological conditions. So first one, it is L81 pigmentation disorders. So disorders affecting skin color changes are listed over here. For example, hyperpigmentation, dark patches, vitiligo, the loss of pigment, and melasma. So L81.1 is for vitiligo. So what do you mean by vitiligo? How do you define it? It's an autoimmune condition where the melanocytes, nothing but the pigment cells, are destroyed. So this results in the white depigmented patches on the skin. So whenever vitiligo is diagnosed, you have to assign the code L81.0. So next is L81.4 for freckles. So freckles are small light brown spots on the skin. So this is caused by the increased melanin commonly seen in the sun exposed areas. So next code is L82, the seborrheic keratosis. So these are the benign non-cancerous skin growths. So these are common in the older adults. So they appear as a brown, black or tan raised lesions with a stuck-on look. So these are often harmless but they may be removed for the cosmetic reasons. So you can clearly see the picture of the keratosis in the right side. This is the benign non-cancerous skin growth which is brown or black in color. So next is L83, acanthosis nigricans. So what do you mean by acanthosis nigricans? These are the dark, thickened, velvety patches on the skin. So they occur in the skin folds like in the areas of neck, armpits and ground. So these are often associated with the insulin resistance, obesity or other hormonal disorders. So you can also see the picture of the acanthosis nigricans over here. So dark, thickened, velvety patches you can find over the neck over here in this picture. Okay. And then L84, it is about corns and callosities. So this is the thickened skin due to repeated pressure or friction. So these are frequently found on feet and hands. So what is the cause? What is the difference between corns and calluses? Corns is friction from pressure points, whereas calluses is it's a repeated friction. So corns are appeared as small, circular and hard center, whereas calluses they appear as larger and broader. Corns are usually painful, calluses are usually not painful. So next coming to L85 code. So L85 is assigned for other epidermal thickening. So this includes skin conditions with excessive thickening. So these are not classified in earlier code categories. So for example, ichthyosis. So what do you mean by ichthyosis? It's a condition where a skin becomes dry, scaly and resembling the fish scales. So this is about other epidermal thickening. So next coming to the code L90 for atrophic disorders of the skin. So what do you mean by atrophic disorders of the skin? It's nothing but a thinning or wasting of the skin. So this occurs whenever the skin loses collagen, elasticity and it becomes thin. This can be due to aging, long-term steroid use or certain diseases. So whenever atrophic disorders of skin are diagnosed, you have to assign the code L90 from the category L90 to L99. So L91 is for hypertrophic disorders. So what do you mean by hypertrophy? It's the opposite of atrophy. So instead of thinning, there is excess skin growth. So this happens due to overactive healing process after the injury. For example, keloid scar. So what is a keloid scar? It is a raised thick scar tissue that grows beyond the original wound boundary. So this occurs when the excess collagen is produced during healing. This is most common in darker skin types, but they can occur in all. You can see a picture over here about the keloid scar. This is a keloid scar on the light skin, how it appears, and the keloid on the dark skin. You can clearly see the difference. So keloid scar is assigned as L91.0 ICD-10 CM code. So next coming to L92 code, it is for granulomatous skin disorders. So what does this include? They include the sarcoidosis of the skin. So granulomas are nothing but these are the clumps of the immune cells formed when the body tries to fight something but they cannot eliminate it. So this leads to raised firm bumps or patches on the skin. So this results in the granulomatous skin disorders. So you have to assign the code L92 for this granulomas. So the next code L98. So L98, it's other specified skin disorders. So L98 category, this is used when there is a documented but uncommon and rare skin disorder that does not fit other categories. For example, the subcode is L98.9. What does it say? Skin and subcutaneous tissue disorder unspecified. So this is used whenever doctor mentions skin abnormality but that exact nature isn't clear or described in detail. For example, if note says only skin lesion without diagnosis, then you have to assign the code L98.9. So this is about the L chapter codes of ICD-10 CM. So this is for today's session. I hope this session has helped you. So in the next session, we will be learning about the anatomy and physiology of one more body system. Thank you.